Hello everyone, this is Dr. Anandt.raut. Today we are going to discuss about the absorption of drug and various mechanism of drug absorption. Let's see.
Absorption of drug. Absorption of drug means movement of unchanged drug from site of administration to the systemic circulation. Let us see mechanism of drug absorption. There are two mechanisms. First, passive transport and active transport. In passive transport, we have simple diffusion, facilitated diffusion, pore transport, ion pair transport, ionic diffusion. Active transport, we have pump transport and pinocytosis, or also called as transcytosis. Let us study passive transport. In passive transport, drugs transported across cell membrane from higher concentration to the lower concentration, that is along concentration gradient without utilizing energy. Drugs which are lipid soluble, that is unionized, are transported by passive transport. Let us study simple diffusion. In simple diffusion, drug gets solubilized in lipid cell membrane and transported along the concentration gradient. Second, facilitated diffusion. In facilitated diffusion, the drugs binds with the carrier molecule called as which is present in the cell membrane and get transported. For example, absorption of vitamin B12 by intrinsic factor which is present in the gastric juice. Pore transport. In pore transport, the drug binds with the protein pore which is present in the cell membrane and get transported. Ion pair transport. In ion pair transport, the drugs get in salt form becomes lipophilic, that is lipid soluble, and transported across cell membrane. Ionic diffusion. Ionic diffusion involves movement of ions, that is transport of ions through ion channels. Let us study the active transport. In active transport, the drugs transported across the cell membrane from lower concentration to the higher concentration against concentration gradient with utilizing energy. Inorganic ions such as sodium, potassium, chloride, calcium, and synthetic drugs such as steroids and hormones are transported by active transport. Pump transport. In pump transport, drug binds with a certain enzyme called as a pump which is present in the cell membrane and get transported by active transport. Pinocytosis or transcytosis. This involves formation of pseudopodium, that is fold, inside the cell membrane. The drug enclosed in such pseudopodium. This pseudopodium pinches off from cell membrane to form vesicles to move within the cytoplasm. For example, absorption of oral polio vaccine.
Hope you understand various mechanism of drug absorption, that is passive transport and active transport, and various their subtypes. Please subscribe, like and share our video. Don't forget to give your precious comments and hit the bell icon button. You can join our offline classroom and you can buy our ebook which is available on the Google Play Book Store. The details are given in the description box. Kindly find it. Thank you. Jai Hind, Vande Mataram.